Capital One bill that could reduce health care costs for Texans now has some clinics worried. Our Charlotte Scott explains why.
When Texans seek care at an outpatient clinic like this one, they're charged a professional fee and a facility fee, just like when you go to a hospital. The first covers the doctor's services, and the second is for resources used at the clinic. The so-called facility fee is the target of legislation that was heard in a House committee Thursday.
It's just the hospital's payment for the services. And what does it go towards? It goes towards the nurses, the equipment that's utilized for a service, everything that's nailed down, the electricity, the front office staff, the medical billing and coding services.
Losses to hospitals.
Nortex's Representative James Frank filed a bill to prohibit outpatient clinics from charging fees for operational expenses related to preventive care or telemedicine. Preventive care includes things like annual exams, colonoscopies, and mammograms. Representative Frank says cutting out certain costs will save Texans money when they seek health care.
Actually, it will take money out of the hospital's pocket. That's the point. But it stays in the pocket of the patient.
But Frank Beeman, the CEO of Faith Community Health System, disagrees. He lives in Jacksboro, a small city 2 hours northwest of Dallas. If outpatient clinics are banned from charging certain operational fees, he says many would close, leaving rural communities without care that's often cheaper and closer than emergency rooms.
Well, if we lose the component of our payments that helps to support the facility, to support the physician to practice medicine, then we've just lost the whole system.
Beeman argues this bill would only benefit insurance companies who want to save money, since they absorb any cost beyond a patient's copay. While he acknowledges that some private investors who buy clinics do tack on extra fees, he says the problem doesn't exist in the public or nonprofit arena. Hospital advocates say this legislation will just put the good guys out of business.
It's so important to stand these clinics up in communities that really depend on them.
The Texas Hospital Association says no other state has banned outpatient clinics from charging patients operational costs. No final action was taken on the bill. For Spectrum News, I'm Charlotte Scott.
Thanks for watching our YouTube channel. And for more refreshing stories about your community, click the subscribe button right over here. You can also download our Spectrum News app to get live news coverage, weather alerts, and more wherever you are. And don't forget to tune in to Channel 55 on Dish and DirecTV for live local reporting every single day. We'll see you then.